Hi, everybody. My name is Kristi Waters. I am the show director and show host of Paramore's Drag Brunch down on the Riverwalk. And we are here at AARC, and we are here with their brand new doctor here, Dr. Cates. And we're going to have some fun. We're going to get him into drag for the first time ever, really. Yeah. And we're going to have some fun. We're going to talk about some sexual health, some questions. We're going to have some fun while we do it. And then I'm going to let you take over right now, I guess.
Perfect. Hi everyone, I'm Dr. Chase Cates, as Kristi said. I'm the newest doctor here at AARC, specializing in LGBTQ medicine, HIV, and internal medicine. I'm very excited to be here and to meet Kristi and to get in drag for the first time. And hopefully we'll learn a little bit as we go.
Are you ready?
I think so.
Scared?
Very.
Good. You should be very scared. So I guess before we do it, let's clean our hands because I don't know where you've been. You don't know where I've been either. I guess I'll just spray you. Merry Christmas. I guess, you have to take it off. Well, the other one too. Take the shirt off. Later. Okay. So I guess we'll start. Tell me a little bit about yourself, like where you're from. Are you from San Antonio? Or did you move here? Sure. And then this is the only part that hurts, I promise.
I grew up in Dallas, so I'm a native Texan. Was there all through high school. I moved away to San Angelo, Texas for undergrad, and then went to College Station, went to A&M for graduate school, and then I finally left Texas when I went to medical school, and I spent 2 years right outside Pittsburgh, Pennsylvania, and then my clinical years oh really? Yeah. Spent a couple years in Western New York in Elmira, and then residency. I moved to Arkansas, and then from there I went to Los Angeles for a fellowship, and then that brought me back here, so I've been all over the place.
Oh. So what got you into the field?
Into the LGBT medicine?
What got you into doing it?
So kind of growing up in Southern culture and then going into medicine, even as a gay man, I didn't know how to provide medical care to my community. There's no training in medical school, there's no training in residency unless it's kind of requested. And so I really felt a deficiency in my knowledge. Just being gay wasn't enough to feel competent in providing the care. And then seeing a lot of the discrimination in medicine, both towards staff and to other patients, really gave me a passion to wanting to look for a solution. And I was fortunate enough that UCLA just started a LGBTQ healthcare and HIV fellowship the year I was finishing residency. And so I applied and got into it, and luckily it taught me hopefully everything I need to know about providing competent care to our fellow community.
So you were talking about discrimination in the work field. If I just scratched you, I'm sorry.
No, you're fine.
I've never done this with nails before. But yeah, you were talking about discrimination in the work field. What do you mean? What did you experience in that sort of?
Yeah. So with patients, I remember in medical school, I was doing a rotation at one of those little standalone ERs back in Dallas, and there was a gay man that came in because he had a sore on his genitals that he was worried he had a STD. And we did a swab and then handed it to the tech to take care of it, to do the test for it. And he refused. He said, "No, I don't want to get AIDS." And the tech. And this was right outside the patient's door, and it's not a soundproof door. I was so mad, but I couldn't do anything. I was a student, and a closeted student at that. And then.
So you weren't even out at the time?
Not to work. I was I guess too afraid that there'd be repercussions for coming out and being gay. So I just kind of stayed quiet.
And how old were you at the time, when all this?
When that happened?
Yeah.
27, 28. It was my last year of medical school, so. And then in residency, there was other times. It was Arkansas, so it was a lot worse. There was a trans patient that I was accepting from the ER, and I don't even remember what the complaint was, I think chest pain. And the doctor, the attending that was giving me the info at the very end said, "Oh, by the way, he says he's a woman and he looks like a woman, but he's not." And I was just, I don't I just said, I don't know what to do with that. This is attending, so he has control over whether I pass and fail, and I just had to say okay, and then go down there and find her and give her the best care possible, the best way I knew how. And there's another trans woman that was begging doctor to doctor to please take her. She needed hormones, she needed care, and no one would take her in, until finally there was one of my attendings that finally was like, why not? And so he took her in, and she finally got care, but it was just ridiculous that she had to keep hunting throughout town to find somebody that would actually care for her as a person.
Like me being a gay man, like, yes, I'm a gay man. I mean, yeah, when you go to the doctor, yeah, you go in, and I mean, I just can't imagine going somewhere and them saying, we can't care for you just because we don't feel comfortable caring for you.
It's ridiculous, and
you know?
Yeah, and I mean, some of the things I experienced myself at the hospital, I was training a PA student 1 month, and at the end, you know how they write you a little thank you card or just say thank you. It started out like, Dear Dr. Cates, thank you for being a teacher, and blah, blah, blah. I don't remember the rest. What I remember was the very last sentence that said, P.S. I hope you find God.
Oh.
And, sorry, it's still...
Yeah, no, I mean, I can imagine, like, you're doing something that you love to do, and you're wanting to help people, and, you know, and then having to, like, witness all this, like, the behind, like, stuff that some people, like, we don't see that because it's, like, behind doors or whatever, and then you're having to hear it and then go back to the patient, and just, I couldn't even imagine having to, like, first being a doctor, having to, you know, tell somebody you have this or that, and then them being in your office, and then them breaking down, and then you're having to, you know, be the doctor, you know, and I don't know, I can't even imagine
and
that kind of feeling.
This case, I mean, it bothered me for like a solid week. I couldn't think about anything else. It's like, why would she say that? We never even spoke about religion. She knew I was gay because I had just gotten engaged to my now husband. And so we talked about wedding plans, and the whole month everything was fine, so I never thought about anything else. And then suddenly, just because of who I am, she assumes I'm godless. And that was kind of my breaking point, where instead of a like don't ask, don't tell, kind of be a little closeted gay doctor, I just said, that's enough. And I did the best I could and educated my peers. Any lecture I did was something LGBTQ related. And then even when they had me do lectures that weren't, I made sure that there was like drag queens on the PowerPoint. And then I started wearing pride shoes all the time.
You got some on today?
Yeah, I actually made these ones.
All right.
Yeah, and just so it was aware, because I figured nothing's gonna change if everyone stays quiet. So I did everything I could at that point. And I think it worked. I had a lot of people start complimenting me. A lot of people were more open and happy for me. A lot of people were defending me whenever like nurses would say things behind my back. And I remember there was one nurse that, as I was leaving, I was saying bye to everybody, and she asked where I was going, and she was like, thank you, like you were a good doctor, we liked having you around. And then she asked the questions, like, where are you going? I said, oh, I'm going to Los Angeles for fellowship. And she said, what's it for? And I said, for LGBTQ healthcare and HIV. And she immediately stopped talking, turned to her computer, and wouldn't look or say anything to me. And she's the one who started the conversation.
Wow.
And I just had to be like, oh, okay. But luckily there was other people there who were fascinated and interested, and they were happy for me. But I mean, that's just kind of the stuff I had to deal with all the time.
So you talked about kind of the, I guess, the negative side of it. So what are some like good experiences from it? Like your favorite ones?
I think once I got to Los Angeles, just finally being in an area that was so accepting and affirmative really helped me come out of my shell. And then one of my favorite aspects of the training there was the gender health clinic, which was specifically designed to take care of gender-related needs. So that's where we saw our trans patients and our non-binary patients and gender non-conforming. And I knew nothing about their health, so I learned a lot that month. But then also to see their experience firsthand, hearing what they had to go through, and then being so happy that they finally have someone to care for them and that they get the hormones or whatever they're needing to match how they feel on the inside to finally show on the outside, and just see how rewarding that is and how happy that made them really was uplifting for myself. And so, ooh.
Well, we don't need that shirt anymore.
So I think that was probably one of my favorite experiences.
I guess, can you tell people what is so important about taking their medication and you know, constantly staying on a routine of staying on their medication?
Yeah. I mean, so when HIV first came out in the 80s, and it was an epidemic, I mean, we had nothing. And so people were dying. It was, in the 90s, it was the #1 killer for people in our age group. And it's very saddening what they had to go through, but we're at a point now where we have excellent medications. It's just 1 pill a day, very little side effects. And it's so easy that we shouldn't be having issues. But down here in the South, and it's a big reason why I had a passion for coming out here, is we have about 36,000 new cases of HIV every year. And I was hitting your mic. Oh. And over half of them are occurring here in the South. And then, as I said, we shouldn't have any people dying of AIDS because of the medication. And yet, of the ones that we do, again, 50% are happening in the South. So the South is getting hit hard. And even here in Bexar County, we're having 300 cases a year, over 300 cases a year. And what's even more scary is that 1 in 7 people don't even know they have HIV. So that's what, 14, 15% of people just potentially spreading the virus because they don't know. And so it's super important to, one, know your status and take your pills, because we figured out that if you're taking your pills every day and getting your levels to undetectable, you cannot pass it on to somebody else. And that's the U equals U campaign that was going around, or still is going around. Yeah. I think I'm wearing that shirt. Yeah, I am.
Yeah.
And so that's super important. And then for those that don't have HIV, getting on PrEP if you're sexually active to help prevent it, and then understanding that if you did get HIV, it's no longer a death sentence like it was. It's so easy, and it's to the point now where my HIV patients, I'm treating their blood pressure, their cholesterol, their diabetes. The HIV is just kind of an afterthought. You're taking your meds? Yes? Okay. Great, you're doing well. I'm getting beat.
That's why they call it beat your face, because I'm going to beat your face.
Yeah.
I don't know, or do you want to ask me anything right now?
Well, I was just, how long have you been doing this?
In October, it'll be 15 years, so I don't know when the video comes out. But 15 years, yeah, doing this.
And how did you start?
I started in Corpus. I'm from Corpus originally. Mm-hmm. And I was in Rocky Horror. So for a whole month, I was basically in drag. And then it just kind of snowballed into this creature today. How long have you been with your husband?
We've been together for 4 years. We just had our 2-year wedding anniversary back in April.
Wow, congrats.
Yeah, we were supposed to do a little celebratory cruise, but COVID hit.
Mm-hmm. Corona's a hoe.
Yes.
So I know that he's not here, but I know he's coming. So are you excited that he's gonna see you like this?
Yes. Yeah, I've never done drag before.
You never even just played around with it?
No, I played around with the idea. Back in college, I guess it's my closest thing to drag. It was Halloween, and I was in a fraternity, and we were supposed to all dress up as actives, and then...
What's an active?
Active is someone who's been initiated into the fraternity, and a pledge
is... true what they say.
Yeah, and a pledge is the one that's trying to get into it. And so we were pledges, and we're supposed to dress up as them and then boss them around for Halloween.
Damn, what kind of dominatrix? What school is this? I need to go
there. It wasn't with whips and chains.
Damn.
But just 2 hours before we were supposed to be there, they called me saying the plan's off, dress however you want. But
so you were already all dominatrix stuff.
Yeah, it's 2 hours, so I had to take off my whip and my leather lingerie.
Put the swing away.
Yeah. And I was just, I don't know what I'm supposed to wear. And I was with my friend and his girlfriend, and she was like, I have something. And she pulled out her suitcase because she was just visiting. And
there was her whips and her chains.
I put on, I don't even know the kind of pants that they were. They're stretchy black pants with a gold halter top. And I had like a Elmira wig, or Elvira.
Sexy.
Yeah. And then I guess a little bit of lip gloss and heels, but that's.
So you walked in heels before?
Yes, and.
So you know how to do it?
I hope so. I don't know about doing it correctly, but.
We'll see today. We'll see what's gonna happen today. So I'm gonna stop, and I'm gonna let you do the rest of your makeup.
Oh no.
Do you want to? You want to try it?
I can try. It's not going to be pretty.
Make sure you follow AARC on Facebook, Instagram, all that good stuff. Follow me, follow Dr. Cates, and we'll see you next time.
Oh.